Join us this
Hello and welcome. This is NTA Tuesday Live and I'm Cyril Stober. The HPV vaccines prevent infection by certain types of human papilloma virus. Now, available HPV vaccines protect against either 2, 4 or 9 types of HPV. Now, all HPV vaccines protect against at least HPV types 16 and 18, which cause the greatest risk of cervical cancer. Tonight, Tuesday Live, we'll be discussing the HPV vaccine with the Primary Healthcare Development Agency. But the program will also be talking about the recent flooding experienced in different parts of the country and the release of water from Lagdo Dam in Cameroon. Join us as we engage experts to digest issues surrounding the development. But before we go into our very first topic, let's get to see this background report put together by health correspondent Olusheye Adiagbu.
Human papilloma virus (HPV) is a commonly transmitted infection that can lead to various health issues, including cervical and anal cancers, among others. And Nigeria in the HPV Information Center has a population of more than 60 million women aged 15 years and older who are at risk of developing cervical cancer. In the US CDC reports, HPV vaccination works extremely well, as the jab has the potential to prevent more than 90% of HPV attributable cancers.
85% of adults are exposed to having the infection at one point or the other in their lifetime, and that 95% of these cervical cancer are caused by the human papilloma virus. Hence the need for prevention, which we always say is better than cure. And so the HPV vaccine that we plan to introduce in Nigeria will prevent our girls from being infected with the virus. And of course, what this means is in the future, we see a generation of girls that are better protected against cervical cancer.
Since the HPV vaccination was first recommended in 2006, infections with HPV types that cause most HPV cancers and genital warts have dropped 88% among teenage girls and 81% among young adult women.
For now, we are going for age 9 to 14. It's expected that they are not yet exposed to sexual activities, and so if they receive the vaccine, they will be protected and they don't get infected with human papilloma virus. So what we're doing now is, by the time you give the vaccine, we are protecting that generation. It doesn't mean that other age group cannot be given the vaccine, but for now that age group is what we are looking at, because we want to prevent them early. Like I said earlier, in US, UK, it's for both boys and girls. They have enough vaccines. We don't have enough vaccine in Nigeria. That's why we are starting with the girls. Like I said, in another 3 to 5 years, when we have enough vaccines, we'll also give to our boys. So the vaccine is not just for girls. And it's unfortunate sometimes we hear people make statements, oh, it's for sterility, for the girl child will not be able to deliver. Those things are stories. We have people who have taken the HPV vaccine. They are today, grandparents.
UNICEF is playing an active role in the HPV vaccine into Nigeria, and for Eduardo Salades, UNICEF Chief of Health in the country, this is a project long overdue for Nigerians.
It's going to be fully for free, with no cost for people going to, for young girls going to public health facilities. So we as UNICEF, we are supporting in social behavior change, and we are supporting as well with the transport and the importation of the vaccines. We are very excited with this new vaccine coming to the country. It's the first vaccine introduced after rotavirus that was introduced last year, and we really think it's going to have an impact, a massive impact in the health of young girls and women here in Nigeria.
For the National Primary Healthcare Development Agency, all is set to introduce the human papilloma virus HPV vaccine to Nigeria's immunization schedule, and has also been strengthening synergy with relevant actors, including traditional and religious leaders. In Abuja, Olusheye Adiagbo.
All right, that report sets the tone for our first discussion tonight. Let me go ahead and introduce our guest. We'd like to welcome to this program Dr. Faisal Shuaib, who is the Executive Director, CEO of the National Primary Healthcare Development Agency. Thanks for being with us here tonight.
Thank you very much for having me. Good evening, viewers.
Right. Let me also welcome to this program Eduardo Celades, is UNICEF Chief of Health. Good to have you.
Thank you very much for inviting me tonight.
Right. And also joining us via Zoom from London is Dr. Zainab Bagudu, MD Medicaid, who's also a board member of the Union for International Cancer Control. Good to have you join us tonight.
Good evening. Nice to be here.
All right. All right, so let's go straight into this discussion. When you say the HPV, the human papilloma virus, what exactly is that?
So the human papilloma virus is actually a group of over 200 viruses that have gained notoriety because of the association of a few of them with cervical cancer, which is a very deadly cancer that kills a large number of women in Nigeria. So up to 12,000 women die every year as a result of cervical cancer. And the whole idea is that this cancer that kills so many women is sort of precipitated when a woman is infected by the human papilloma virus. So it is one of the viruses that is sexually transmitted.
Okay, because you just said when a woman is infected, we were going to say what's the source of infection?
Right.
Okay, and it's only transmitted through that means.
Yes, it is usually transmitted through sexual means, but of course, apart from the cervical cancer that it causes, it also causes other types of cancer. So it causes other types of cancers that involve the private parts, the male private part, the female private part, but also causes throat cancer, cancers of the tongue, oropharyngeal cancer, those is neck cancers.
Once you say it's cervical, you know, the first thought is that it's just the cervix alone that it attacks, but it can also cause cancers in other parts.
Absolutely, it is recognized to cause other cancers. So just to look at it from a global perspective, over 300,000 women have died every year from cervical cancer, and just to capture the fact that most of these deaths occur in low and middle income country. 90%, as a matter of fact, of these deaths occur in low and middle income countries like Nigeria. This is largely because the public health facilities, the public health resources to actually identify these preventable cancers are limited. So cervical cancer is a cancer that is completely preventable, especially when vaccines are taken, when screening is done, and when it is caught early, it is actually possible to treat it. But because of the weak health systems that we have, you find a situation where women die from a cancer that is perfectly preventable.
All right, we'll return to you in just a moment, but Eduardo Celades, just give us your perspective of this.
So maybe let me start by the global perspective, right? We know that the HPV vaccine works, it's safe and it's effective. Already 125 countries are already vaccinating girls and young women against HPV. We as UNICEF, we support 52 of these countries to get the vaccines in country, right? So this year, in 2023, 8 new countries in the world are going to introduce HPV, being Nigeria maybe the most important one this year, in 2023. Main issue that we are seeing is like a lot of girls in the world and in Nigeria, of course, they don't have access to the vaccine. And as well, during COVID-19 times, we saw like an increase of resistance to vaccination. So as well, we saw a global decrease of the number of girls that they are reaching the vaccine, they are getting the vaccine. For us, it's very important really to have this tool available because we know that it's going to reduce mortality. We know that in the world there are more than 600,000 cases per year of cervical cancer, and more, as Dr. Faisal was saying, it's more than 300,000, about 350,000 deaths of women every year that they are fully preventable. So for us, we as UNICEF, we are committed to support the government of Nigeria to introduce successfully the vaccine, so we ensure that the young girls are protected.
All right. Well, let's go over to Dr. Zainab Bagudu as we link up with her via Zoom. Dr. Zainab Bagudu, just give us your views on this first. I know you're also a board member of the Union for International Cancer Control. Are we seeing more cases of this, and generally cancers all over the world? Is it increased awareness that now makes us know and we have these statistics, or somehow we're seeing more cases?
Thank you, Uncle Cyril. I think that, yes, indeed, we're seeing more cases, mostly because of the fact that there are a lot of lifestyle changes, and there is more awareness and the capacity and ability to detect the cases more. In low middle income countries, there is a great inequity that exists when you compare to the higher income countries in terms of the incidence, the prevalence, the number of people that survive cancer, and then of course also the outcome, the deaths that we have. If we look at the cervical cancer that we're talking about right now, in Nigeria, a country of how many, over 200 million people that are exposed to this risk, we're only just starting the vaccine. And we have every year a reported number, according to GlobalCan, of 2020. So that is a bit dated now. We have over 12,000 women diagnosed annually with cervical cancer, of which over 60% of them end up in death. Most of these cases are diagnosed late. So yes, to answer your question, globally, there is an increased awareness, there is an increase in the incidence of cancer. There's so much going on in terms of climate change, in terms of antimicrobial resistance and abuse, and the environmental pollutions that is causing us to develop cancers more. So we do need to step up our acts, not just in terms of vaccination, but in terms of our lifestyle, the kind of food we eat, how much we exercise, and other vices that we all know lead to cancers.
All right, thank you so much. Back here in Abuja, Dr. Faisal Shuaibu, and this would be the question many people would really put across to you. You did say that the vaccines, if you can vaccinate, if you can make them available to young girls, then there's a high chance of preventing this HPV. But again, you say it's sexually transmitted. So that presupposes that there is a man here involved. So the virus, arguably, is the man, the male that carries the virus, right? Or how?
Not necessarily. So the virus is sexually transmitted. What it means is that when there is the act of copulation, that virus can be transmitted either from the woman to the man or from the man to the woman. But perhaps there is no greater impact that we see in the effect of HPV than when you see a woman dying from cervical cancer, and you know that this is in 95% of the cases due to the HPV virus. So this is our daughters, our sisters, our mothers, our friends actually being exposed to this virus at a very tender age. This is why we are introducing this vaccine to girls between the ages of 9 to 14 years at the point where they are not exposed to sexual intercourse, right? So that the vaccine elicits an immune response. So it gets into the body, mimics the actual virus, and the body fights the particle of the vaccine. And then if the actual virus now attacks the body is able to memorize, because of the vaccine that the individual has already taken, and fights the virus and then eliminates the virus. So the virus doesn't have the opportunity to remain in the body and then lead to cervical cancer. While in females, the virus causes cervical cancer, in males, it causes penile cancer, right? So it is a disease that can actually, be transmitted, whether it is by the male or by the female.
Okay. Mm-hmm. So is the vaccine now only effective for girls?
No, it is not only effective for girls. So first and foremost, this is a vaccine that is quite expensive. It's a vaccine that is, the supply is limited. So different countries are, of course, wanting to have access to the vaccine. So what epidemiologically science has shown is that first, if you are able to catch the girls young, you vaccinate them, then you are able to protect the boys as well, because what that vaccination does is to create what we call a herd immunity around the community. So if the girls are protected, then even when they grow up and get married, then they do not transmit the virus to their male, to their spouses.
I was just going to say age 9 to 14, that's rather young, isn't it?
It is, but as Dr. Faisal was saying, is the right age. I will share my personal experience. I have a 8-year-old daughter living with me here in Nigeria, and I am just waiting for the launch, like for next year when she's 9, I will be vaccinating her. It's the right time to do. In public health sometimes it's better to anticipate events, and it's better prevention than cure. We know that. As well, just building on what Dr. Faisal was saying, there are like about 40 countries in the world that they offer as well a vaccination for male, right, for men. But this is an issue of prioritization, right? It's like we have limited resources, and we need to choose who needs to be protected more. And we know that most of the cancers are among young girls. So that's why here in Nigeria is girls from 9 to 14 years old. As well, just think that globally, this year there are only 36 million doses of vaccines available, 36 million. And for Nigeria is getting 6 million doses for the young girls in Nigeria. So it's one of the 6 doses that they are in the whole world are coming here. So this is, I think, it could be challenging because it's a new, normally vaccines, as you know, is for children, right? People think, maybe that they think in COVID-19 the last few years for adults, but they normally think like the small children. This is going to be a new age range. I think we'll need to work a lot with communities, with teachers, with the schools, etc., to really to create demand for the vaccine. I believe like when the vaccine is launched, there's going to be a lot of demand because first of all, it's going to be for free, right, in any public health facility of the country. And when we know that these vaccines, as Dr. Faisal was saying, are quite expensive. But to me, an issue is going to be what happens after the after the campaign? What happens after 1 year when really HPV vaccine is just going to be available in the health facilities? Are we going to sustain that demand? Are still like any young girl and the parents going to the health facilities to vaccinate their 9, 10, 11 years old? So this is something for reflection to see how we, as a country, how Nigeria can really ensure this sustained demand of the vaccine of their years to really reduce the cancer in the long term.
Dr. Zainab Bagudu, if we were to take into consideration the challenges of immunization and vaccination in this part of the world, how do you think this can be surmounted with the introduction of the HPV vaccine at this time? If you recall how difficult it was to get people to take the COVID-19 vaccine, and even before then, there are still challenges with people making their children available for the routine immunization.
I think that's the most difficult question that you're going to ask this evening. I'm wondering why I got it, but I'll give it my shot. Nigeria, a big country, a very complex country, a very diverse country, but also unique in that we know ourselves and we know our peculiarities. How we introduce the vaccine is the most important thing. The method and the demand generation, the awareness that we create in Sokoto must be absolutely in context of the people of Sokoto, of their religion, of their culture, and of their health-seeking behavior, as opposed to what we're going to do in Enugu. Again, we have to take into context those two places. I think in the past, what has happened is we've tried to use a one-size-fits-all demand generation model. Development partners come in and feed us with this is the way to do it, and we do it that way. And we saw the detrimental effect that had with things like polio, for instance, and even our routine immunization. But as the years go by and we're more involved in our work plans, the governments, the civil society, the medical professionals, agencies like the NTA, CDA are able to give their own input and work on the plans with UNICEF, then we have better outcomes. Our traditional rulers are very involved. Our religious rulers are very involved, and the civil society are also very involved. So yes, there are bound to be some kickbacks. Any new vaccine is going to have some issues, sometimes not just the anti-vaccine people, but even just from our own people that don't trust anything. But the key is how we introduce it. Somebody said to me today, I got a message about going around on WhatsApp that was sort of targeted against the vaccine, and it was from the northern part. So she said, and I was feeling quite bad about it, and they're going to spoil all our work for how many years. And she said to me, no, we should be happy. It means they've heard. That means we're doing something right as long as they've heard. For this community of people to compose a message like this in Hausa, it means they've heard and we're doing something and we're on the right track. So a lot of work has to go into it. A lot of work has gone into it. And I'm pretty sure that by the time the vaccine is fully in our health systems, it's not going to be a problem. We've had issues, but we also surmount them. Civil society is very active and very behind this vaccine, and it's going to be a success in our country.
All right, Dr. Faisal Shoaib, safety concerns. It's always the first thing when you introduce anything. What effects, what side effects, what are the safety measures? How can people trust this vaccine?
Thanks, Cyril.
Because you know, the whole thing about a vaccine is you take an otherwise healthy body and you introduce something that mimics, as you medical people say,
the actual pathogen. Yeah.
Pathogen.
Yes.
And first there'd be concerns about, well, this is mimicking the actual pathogen. How are you going to be sure that it's not the pathogen that's been introduced into the body system? And what are the side effects? Any long-term effects? Things like that.
So first and foremost, let me just allay your fears. by telling you that this vaccine has been approved by the World Health Organization from a global perspective, by the Food and Drug Authority of the U.S., European bodies, but even right here in Nigeria, NAFDAC has already approved the safety and potency of this vaccine, and I'm sure that in the next couple of days, the Director General of NAFDAC will come out and tell Nigerians about the safety and efficacy of this vaccine. Like any other vaccine, once you take an injectable, the expected side effect will be that there will be some local pain, there will be a little bit of swelling, and for some people, they might feel a little bit tired, body aches and pain. These are usually mild effects. Majority of people will experience this mild effect, but we also know that thanks to the collaboration between the Federal Ministry of Health, National Primary Healthcare Development Agency, and NAFDAC, we're able to track every single vial of the vaccine from the point where it is administered to where the person is. And we have the Med Safety app that has been developed by NAFDAC so that if people experience any form of side effect, they're able to report it. But Cyril, I also don't want us to focus too much on the vaccine. The vaccine is very, very important. But what we are going to be doing as a Federal Ministry of Health under the leadership of the Coordinating Minister of Health and Social Welfare is to come with an ambitious, concerted, and inclusive plan to not only focus on the vaccination, but also the screening that is required and also the management of cervical cancer. The vaccine prevents it, but we also know that even before it gets to a stage where the cervical cancer is at its terminal end, what do we do about screening? So we're improving at the primary healthcare level the capacity of health workers to be able to screen women when they come, so that it is part of the routine assessment when any woman comes to the health facility. Our plan also is that we follow the global strategy that has been adopted by the World Health Assembly, the 90%, 70%, 90% global strategy for the elimination of cervical cancer. What does that really mean? That means that 90% of girls should get their vaccines before they are 15 years of age. It means that 70% of women should have a high impact test to screen for cervical cancer by the time they are 35, and then repeat again by the time they are 45. 70%, and then the last 90% is that 90% of women that have pre-invasive conditions should be treated, and for those that are already invasive cancers, that they should be managed. Now, this is a global strategy if we're going to be able to eliminate cervical cancer by 2030, and Nigeria has signed up on this, and there is a global national effort. Part of this effort is the introduction of this vaccination program.
Now that you speak of screening, what's the situation like now? How often do people screen for things like
So right now, this is why the Federal Ministry of Health is taking this as a priority. Right now, the level of screening is not happening to meet the global standards. It's not happening to the level that we'll be able to say we have achieved those targets. So the target again is that by the time a woman is 35, right, in 70% of that population, they will have at least had their first screening, and then the second one by the time they are 45. Right now, we're not saying that kind of screening, and it is partly responsible for the large number of cases and deaths. Dr. Bagudu mentioned it earlier, that every single year, up to 12,000 women die from cervical cancer, and this is perfectly preventable. In Nigeria, we find a situation where 80% of women that have these terminal types of cancer do not have access to care. 80% of them end up dying due to late presentation of the disease. So it is a disease that requires urgent attention, and this is what the administration is doing to try and now refocus our attention on this type of cancer.
Two things we'd like to put across is, are there any specific number of doses to be administered, and once a dose has been administered, is it a lifetime protection?
Okay, so here in Nigeria, NAFDAC, so the vaccine is going to be introduced, is called Gardasil, and with one single dose is going to be enough. So in other vaccines, they need 2 doses, and that was the previous indication for other vaccines, including this one. But now the last studies show that with 1 dose, you can get protection, right? The protection in principle is for 10 years, but as well can be longer than that. But at least ensures you 10 years of protection with 1 single dose of the vaccine.
Okay.
But as Dr. Faisal said a little bit, this is like, it's a very powerful tool, but we need to put it with other tools, like the screening, like the PAP test, the HPV test, and we need to do a lot to strengthen our system, our primary healthcare system, to be able to provide this screening. One of the main challenges that I think we are facing here in Nigeria is the weak health system, especially at primary healthcare level. There are not enough doctors, there are not enough nurses, there are not enough midwives, weak supply chain, etc. So how, just thinking beyond the vaccine, but how we strengthen this system, how we ensure that there are enough investments in the right places, in the right PHCs, this is going to be key to go with the vaccine. Not only the vaccine is a tool, it's a very powerful tool. Likely it's the most powerful, but it's never enough. We always need to think in the big picture.
Okay, once again we go over to Dr. Bagudu, and yes, 1 single dose is enough. Protection might be for about 10 years or more, but I'm looking at, for those who unfortunately have been infected already, how is the HPV managed? And for those who have been infected, could they still take the vaccine?
First of all, infection is different from cancer. And like we have heard severally, there are many different types of cancers that the different HPV viruses can cause. If we stick to cervical cancer, which is the highest number, or it has the highest incidence as well as the highest number of fatalities, we find them very late in Nigeria. Typically, you find women come to the healthcare facility late because there's no regular screening process, as we have heard as well. And this makes it very difficult for treatments to be successful. If we're able to put in place the 90-70-90 global strategy, of which Nigeria was one of the countries that signed up to it and started that strategy, then we really have a responsibility to put more screening facilities in place. But how our people take that up depends also on this system. Yes, in Kebbi, for instance, when we were working on the health system in Kebbi, we were able to really improve the outcomes of things like routine immunization, screening, and even treatment by strengthening the healthcare system, by putting in a lot more investments, not just from the government, but from the partners, from the federal government, and from different partners like Gavi that are focusing on strengthening the cold chain system so that our vaccines can be delivered in a better way and more effective way to the people in the rural areas that make up the most cases in Nigeria. The outcomes are not good because we're not picking them up early, is the short answer to your question, Uncle Sarah.
All right, in firming up the health systems here, which you talked about, will this initiative be through persuasion? Will it at some point be mandatory, including this vaccine when it is eventually launched?
No, the vaccination against human papilloma virus is going to be voluntary. I believe that the evidence is there. The data speaks, to how effective the vaccine is. In the United States and similar countries, they've seen an 88% reduction in the number of, cervical cancer cases because of this vaccination. We're actually coming late in the game in terms of Nigeria. If you go through the historical antecedents, you find that since 2014, South Africa already introduced the vaccine. In 2015, Uganda introduced it. In 2016, Liberia introduced it. In 2017, Botswana introduced it. In 2018, Tanzania did. In 2019, Rwanda, Kenya, Malawi, and Zambia actually already introduced this vaccine. So we're actually coming late in the game. And because there are antecedents, I'm sure that people will really understand that these vaccines are safe. We had similar challenges, of course, with the introduction of COVID-19. There was this noise, especially on social media. All those people that took the COVID-19 vaccine are going to die after 6 months. After 6 months, they say, actually, it's going to be after 2 years. It's been over 3 years. Absolutely. And, people are still, absolutely. So we feel pretty confident that Nigerians will come all out en masse to take the vaccines, because they will understand that, again, government means well, and this is one tool that will prevent cervical cancer. We're engaging with traditional leaders, we're engaging with religious leaders, faith-based organizations, the Ministry of Education, the Ministry of Women Affairs, to make sure that there's a common and shared understanding that this vaccine is a powerful tool. The science is very clear. We know that this will strengthen the individual's immunity, it will build stronger communities, and it will help the socio-economic development of Nigeria when such vaccines are introduced and we have less people falling sick due to cervical cancer or dying due to cervical cancer. So it is really an all-round positive impact that it will have on the economy.
Who shouldn't take this vaccine, and under what conditions should it not be administered?
There are very few and limited contraindications to this vaccine. Pretty much, people can take it, except when, of course, there's a previous history of allergy to maybe a dose or some of the components of the vaccine. For those women who are pregnant, there's still limited data on the safety during pregnancy. And then for those who are immunocompromised, they have to have that conversation with their medical provider to advise them as to whether or not they should take this vaccine. But pretty much the safety profile of Gardasil, which is the type of HPV vaccine that we're introducing, is very, very safe. And apart from the safety, we have seen that it has a lot of effectiveness against all 9 types, the 9 common types of the HPV. So we're talking about type 6, the HPV type 6, 11, 16, 18. We're talking about type 33, type 45, type 54, type 58. So we have broad coverage. So Nigeria took its time to introduce the vaccine, but we're introducing it at a time when we're getting the right vaccine, a potent vaccine, an effective vaccine that will help protect our girls, our women, our sisters, our mothers.
You say this vaccine is expensive, and 60 million was what you said is available this year, and all over. Well, seeing how effective it is against a major health challenge, one would wonder why the world is sitting back and not putting in as much resources as they should to tackle this.
I think that the world and partners like Gavi, the Global Alliance for Vaccines, and UNICEF, WHO, and with governments, we are working together to try to make the vaccines available. It's 36 million is the global pool this year available, and 1 out of 6 are coming here to Nigeria. As it's in public health, normally what we do is to look to the mortality, to the years averted of life, and to try to make rational decisions, right? An example, for example, is when you look to under 5 mortality here in Nigeria, you see that the main causes are diarrhea, malaria, pneumonia. And we have already like 2 vaccines for 2 of them, right? The pneumococcal for pneumonia and rotavirus for diarrhea. And hopefully next year we'll have other tools like the malaria vaccine. So we always look from the cost-benefit situation, right? So it's like, what is the tool that we have that can result in a bigger win for more people? But I would like to highlight as well the issue of inequalities, because as well it's very important that all the girls that they need it, they have access to the vaccine that they need. And one of the big risks that we have is like we are able to access to young girls in urban areas, in FCT, in Lagos, etc., but not in very remote or inaccessible areas, in the Northwest, in the Northeast, or even in urban slums. So I think that when preparing this campaign to introduce the vaccine, it's very important really to look to inequalities. It's not the same Lagos or New York like Sokoto, Kebbi, or Maiduguri. And as Dr. Bagudu was saying as well, to really tailor the message to the communities and to the reality of the different contexts. So we as UNICEF, we are working very closely with MPHCDA and the Federal Ministry of Health to really have tailored messages, so working with community leaders, traditional leaders, religious leaders, but as well with celebrities, as well with, with different influencers in social media. We need to use all the tools that we have available to try to reach the girls and to empower them to make this decision as well.
Well, Dr. Bagudu, you spoke earlier on about lifestyle changes. I'd like to dwell a little bit more on that. As you build a more robust health system, vaccination is a tool, but again, you highlighted changes in the lifestyle of the populace, and we see that a lot, especially among the urban elite and the rural poor.
Okay, like I said, it's one of the reasons why we have a higher incidence of non-communicable diseases generally. If we look at our diet, and we start with that, and the contents of the food that we're eating, the additives that it contains, sugar is a big deal now. We're happy that the Nigerian government has passed, or the Nigerian legislature has passed a law that introduces a small tax for sugar, carbonated drinks and sugar-containing foods. However, that was postponed, and we haven't seen it being implemented yet, and we're not sure if it has been benchmarked or earmarked specifically for non-communicable diseases. So what we eat and what we put into our system, and avoiding the unhealthy foods that we all know, eating more of vegetables, eating more of avoiding red meat, fish, and so on, and avoiding all the sugar-containing drinks. Then also exercise. Yes, you are quite correct, particularly in amongst our urban elites. Everybody has a car, there's less walking, there are security issues, but even in the rural areas where they're not as industrialized and using cars, you find there's an influx of different things like alcohol, tobacco, using not really exercising as much as we should be exercising. So these are all things that we need to look at and focus on, and of course accepting the vaccinations that are available. Our children are lots of the time on their computers. When we grew up, we would walk next door to the neighbors and jump around, but now we're afraid and we lock them up indoors, and they're using living sedentary lifestyles as opposed to doing more of the exercise. This is not unique to the global north. Also, for us in the south, we're seeing a lot more of that happening. Having said that, though, I must say that the younger generation, I have a Gen Z, so she doesn't feel that I've attacked them on this program. They are very conscious about their health. They do exercise, and we need to encourage them more in our messagings and how we motivate them to do more of that. We're seeing an improvement much more than maybe my generation that are not so used to biking. They want to ride their bicycles and go to different places as opposed to using the car. They ride horses and things like that. So yes, we need to encourage them. Yes, we need to improve our lifestyle. We need to focus on drug abuse and a lot of all the other vices that we see in the society that we're living in.
All right, taking it up from there, your health facilities. Now, this vaccine has been introduced next year?
No, actually this year.
This year.
Yeah.
From when? What? Any specific date?
So right now we're working with an introduction date of the 25th of September, but that is going to be contextualized, like
right.
we mentioned earlier. It depends on how ready the states are, and also we're looking at when we'll also be able to get President Bola Ahmed Tinubu to actually launch this as a national program, because in his renewed hope agenda, he was very clear about protecting the lives of women. So this is one vaccine that will help reduce the number of women that are dying. So we know that President Bola Ahmed Tinubu is interested in ensuring that Nigerian women get protected from these types of diseases, and this is why he has given the mandate to the Federal Ministry of Health to make sure that there's sectoral engagement around this vaccine, because this is not just a health issue, it's a social economic issue. It is an issue that involves different ministries. This is why there's collaboration ongoing with different ministries, but also different sectors of the of the country will have to use the power of science, the strength of our communities, and the spirit of resilience of the Nigerian nation to be able to ensure that we eliminate the cervical cancer from Nigeria.
So far, what's been the response from the states?
So far, we are very sure that these 6 million doses is not going to be enough. This 6 million doses is going to be for the first phase that involves 16 states, right? And this selection of 16 states is based on the risks. So these 16 states are cut across the different zones, right? So for example, in the south, it's Bayelsa, Akwa Ibom. In the southwest, it's Lagos, Ogun, and Osun. In the southeast, it is Abia and Enugu. In the north central is Nasarawa, Benue, and the FCT. In the northeast, it is Adamawa, Taraba, and Bauchi. In the northwest is Kano, Jigawa, and Kebbi. So 16 states are going to be the first states where we introduce this, but by the first quarter of 2024, the remaining 21 states are going to be part of the program. So it's really based on where the risks are and some of the logistical conditions. So every state is different, and we expect that as states become ready, then they will roll out the program.
Well, just one more thing about the vaccines themselves. And your facilities are capable of handling these vaccines. If you recall the early days of the COVID-19 vaccines, there were challenges with the preservation of these vaccines. We started with one particular vaccine and then moved over to another.
Yes, you remember very clearly, Cyril. So the very nature of this vaccine requires that we are not focused on just the health facilities. We're collaborating with the Federal Ministry of Education and state ministries of education, because a lot of these girls between the ages of 9 to 14 are going to be school-based. So we're working with the school health system to try and deploy the vaccines to the schools. But also for those girls that are out of school in the communities, we're also going to reach them in the communities. One thing that we're sure of is that the primary healthcare system is challenged by a lack of human resources, the infrastructure issues, the issues around commodities and drugs. But one thing that the government has done, thanks to collaboration with Gavi and our alliance partners, we've been able to deploy at least one solar direct drive, one cold chain equipment per political ward. So in every single political ward that has a functional primary healthcare system, there is that refrigerating system that can keep the vaccines potent. So we do not anticipate that there will be any problem with keeping the vaccines at the temperature where, whether it is in the rural area, in the urban area, the vaccines will be kept safe and they will be delivered wherever it is. But really, this particular model will require us going to the schools and also going to the marketplaces, going to any place where we can find girls that are between 9 to 14 years of age.
All right, we're about rounding off on this segment, but first let's go to Dr. Zainab Bagudu and say, what are your closing comments on this initiative?
Well, I welcome it. We've been agitating for so long to have our girls catch up with the rest of the world. There has been a very great inequity and injustice done to girls in low middle income countries, in particular Nigeria. Gavi has a target of reaching 82 million girls this year with the HPV vaccine. 60 million of those can come from Nigeria. We've heard that 6 million will be delivered to Nigeria. It's a small amount, it's a start, but I think it's a very, very small amount to catch the population that we need to. And until we address the issue of Nigeria, it's not going to make a difference. We're not going to be able to reach the targets that we're aiming to reach by the year 2030. So we welcome it, but we know that a lot more needs to be done, and everyone needs to pull up their socks and let's really put the money where it is required. And where it is required is in the larger countries like Nigeria, like India, that have been left to the last. We have the Western countries where boys are getting the vaccine routinely now, not just the girls. So we need to do a lot. We need to do it now.
All right, thank you very much, Dr. Zainab Bagudu, MD, Medicaid, and board member, Union for International Cancer Control. Thank you very much for being part of this discussion.
Thank you, Uncle Sarah.
All right. And a quick word from you as we round up.
So thank you very much for the opportunity of being here today. We as UNICEF, we support fully this initiative of the Federal Ministry of Health and MPHCDA. And we believe that the initiative will be successful if three things are in place. The first one, if there is confidence around the vaccine, and that's why we have all this work before the launch and introduction to ensure that there is confidence, that the parents, the teachers, the girls, they have the certainty that the vaccine is safe and effective. The second thing that we believe is needed is to tackle inequalities. Right? We need to be able to reach the girls that they need the vaccine, and that's why the campaign with the micro-planning is ready, and all the work at LGA level and the state level should happen over the next few weeks to ensure that the launch is a success. And the third one is, like, for us, HPV vaccine is an opportunity to work with young girls, right? It's not only, the intervention doesn't finish only with the vaccine. It's an opportunity as well to later on to talk about nutrition, to talk about empowerment, to talk about how to avoid teenage pregnancies. So it's really an opportunity, the HPV as an entry point, to really improve the health of young girls in Nigeria.
All right, thank you very much. And to conclude, Dr. Faisal Shoaib, we have to ask you this. What's the status generally of immunization in the country now?
So we've seen a gradual improvement in the immunization coverage from around 33% in 2016-2017 to now 57%. We're not where we need to be, but immunization is very, very critical. And I want to really emphasize how special this HPV vaccine is. There are only 2 vaccines globally that prevent cancer. We've already started with the the hepatitis vaccine that protects against liver cancer. This is another cancer-preventing vaccine, the HPV vaccine that protects against cervical cancer. So we're at a point where this vaccine is a beacon of hope. We're harnessing all of our ambitions, and we are sure that collaborating with religious leaders, traditional leaders, civil society, the work that we're doing today, introducing this vaccine, will echo through several generations unborn, and we will look back and see and recognize that this was a major step in our drive to improve the health status of Nigerians. So we're all very excited about what the future holds.
All right. I'd like to thank you very much and leave this conversation here. Dr. Faisal Shuaib, Executive Director, CEO, National Primary Healthcare Development Agency. Thank you for being here.
Thank you very much for having me.
Right. Coming up shortly will be a second segment which will deal with the cases of flooding that we've witnessed with the rains at the peak at this point in time. So, and when we come back from this short break, we'll be seeing our next background report to lead us into that discussion. Stay with us on NTA Tuesday Live.